Hi, this is Amy Robbins with Youthful Magnolia. Welcome to Youthful Magnolia After Hours. Today we have two special guests. I have one of my nurses, Grayson, who works here with us, and we have our fabulous plastic surgeon friend, Dr. Halani from Dallas, Texas. So Grayson's joined us from Virginia, and she's got a pretty big background. She worked with a plastic surgeon there. She's laser certified and all the fun things. And Dr. Halani, I had the privilege to watch not too long ago do surgery, and you're pretty much a master, I've decided.
Wow, that's really nice, Amy. Grayson, thank you guys for having me here. I'm Samir Halani. I'm a board-certified plastic surgeon here in Dallas, Texas. I specialize in deep plane facelifts and facial rejuvenation, and I feel really fortunate to be here to talk to you guys about the bridge between surgical and non-surgical interventions.
Yes, this is exciting.
Yeah.
I think we have a lot of patients that want to hear this, so I'm very excited. All right, Grayson,
Perfect.
tell us a little about you.
Oh, about me. Some
Yes.
background about me.
Yeah, just a little tiny background.
I'm originally from Louisiana and started in the peds ICU there after nursing school, and then moved to Richmond where I met a fabulous plastic surgeon, and he kind of took me under his wing and introduced me to the aesthetic world. Worked with him for about 3-4 years and moved down here and met Amy. Saw all the fabulous things that she has here.
Yeah.
And have been here ever since.
Awesome. Well, let's dive into this for a second here, or let's go ahead and start.
Absolutely.
So you and I are kind of text some. What do you want to start with first?
I think we talked earlier about the anatomy of the female neck and
Yes.
the ideal neck. I think
Yes.
that was
that was
a
your
good
study,
starting point.
or
Yeah.
publication, which
Yeah.
I love, which is where you guys revisited like what is the ideal neck
Yes.
and jawline, correct?
Absolutely.
And so, and that's something you're using when you do your assessments and you put your face and neck lifts together,
Yeah.
which I think is really important. So, what came of that?
Yeah. So so historically, people were kind of subjectively deciding, what is beauty, and when it comes to the neck, there was a study done in the 1980s by this guy named Ellenbogen, and he sort of arbitrarily picked 5 criteria to determine what is the ideal neck.
Mm-hmm.
And this include the definition of the sternocleidomastoid, the cervical mental angle, a prehyoid depression, and really trying to figure out, how sharp of an angle your gonial angle was.
Mm-hmm.
And he sort of arbitrarily put these together. And so our team over at UT Southwestern with Dr. Mike Lee and Victor Chang, the 3 of us did a crowdsourcing study where we surveyed thousands of people
Oh,
to identify, what do you think is the ideal neck?
okay.
And, putting 5 different criteria together for each of these different subtypes, from the most extreme and like an extremely defined and then almost a skeletonized neck
Uh-huh.
to a more full neck, we tried to define and really see, okay, what do people think is beauty? And so it was interesting, everybody kind of picked the middle of the road answer, as that was like sort of the most popular answer. But it's interesting when you actually talk to patients about what kind of look they want,
Mm-hmm.
not everybody wants the same thing.
Yeah.
And so, there's a lot of talk about the deep plane facelift and all these different techniques. But to me, none of that stuff really matters. It's about listening to your patient, figuring out what they want and what their individual idea of a beautiful neck is,
Uh-huh.
and custom tailoring the operation to that.
Yeah.
And so we talked a little bit about, there's this big conversation about deep neck work and
Yeah.
submandibular gland contouring.
Mm-hmm.
Some people don't want that really chiseled, defined look.
Uh-huh.
And so I think for me in my practice, I have patients that I've taken glands out on and patients that I haven't taken glands out on. And I have a slideshow. I show each patient an example of, okay, these are patients that didn't have their glands out. These are patients that had their glands out. What looks better to you?
Oh.
And then that way you can
Interesting.
figure out, like, okay,
Yeah.
this person doesn't want this
Uh-huh.
extreme look.
Right.
But I guess the heart of the matter is that each person's different,
Mm-hmm.
and each patient wants a different look.
Yeah.
And having an honest conversation with your surgeon is really, that's the foundation of all of this stuff.
Yeah.
But yeah, I think it was pretty interesting.
That is interesting. I kind of read a bit of it and trying to think of how we would, apply it to the aesthetic side of things. And I think that people's expectation and the reality of things is very skewed when it comes to like, oh, I want jawline filler or I want this. And, if you've got kind of a thicker neck or you've got quite a bit of laxity or pretty big submental space, there's some debulking that needs to happen before you can start throwing something against, and creating that jawline that they want.
Yeah, I'd love to know what your conversations are like with patients that come in terms of like, say you have somebody with an obtuse neck and you're like, how do you approach that? I'd be so curious to know, because people come in, I'm sure, being like, oh yeah, I'm just going to get a bunch of jawline filler and Botox in my platysma and everything's going to be tight.
Great. Yeah.
So how do you approach that? How do you approach that conversation?
Yeah. So I have to kind of start with what you're saying. I'm like, it takes more than just like, is this going to be a bunch of jawline filler? And first and foremost, it's not like 2 syringes, when you're looking at trying to rebuild a jawline, and they're not wanting to do surgery or whatever. I mean, that's, quite a big treatment plan, because like, there's platysmal muscle involvement. You've got probably chin involvement. You've got to create that gonial angle a little bit more sometimes to extend it back more.
Yeah. And
so, it's a very long conversation, and it's just kind of going through like, how much is that going to cost the patient, and if they're willing to spend that and invest it. I do love to use like oil therapy for like submental debulking more. And like in Korea, they use it a lot to debulk the face, because I think the Korean dermis must be quite a bit thicker than Caucasian or American dermis.
Yeah, sure.
So a lot of times, that might be the first route with some neurotoxin, because that's kind of an easy paired treatment.
Okay.
And then we kind of let that sit and see what the results are, and then kind of work on the rest of it with usually hyperdural radius or some Sculptra.
Yeah, that's great. I think that kind of segues into what we were just talking about is, as people age, this sort of bridge between surgical and non-surgical intervention, as people age, that Val Lambro study about facial aging and bone loss, there's sort of an overlap between restoring volume with surgery and non-surgical ways. Like with surgery, it's fat grafting.
Right.
But with non-surgical ways, there's filler and biostimulants.
Yes.
And so I guess another question I have for you is, how do you sort of decide whether you're going to use a filler for bone restoration or the appearance of bone restoration versus a biostimulant?
Well, for me, because of the way I've kind of taken the courses to learn how to use the biostimulators with Radius and Sculptra, I don't use a lot of filler unless it's like lips.
Excellent.
Or like a little chin shadow or something, like a little perks of it. And so that's kind of the part of the treatment plan is like, well, let's start with, Sculptra on the periosteum to kind of help maintain or rebuild that bone structure.
I love that.
We use our hyperdilute radius for skin, and then I love bringing in our skincare and then lasers at some point. So that's kind of how
awesome.
I do it. And then now our reps, unfortunately, don't, they're always like, you can meet this tier if you'll just order this much more. And it's like, oh my gosh, y'all are killing me, and so then you kind of feel like you're kind of handcuffed to use it sometimes. And not that I hate to say that on camera, but it's just the way it is.
Sometimes
you do
happens.
kind of feel that way.
Yeah.
But then you do have those patients who they want to see that immediate gratification. And so I do think maybe some Restylane lift or something plays a good part. Contour,
high G prime,
stuff. Yeah, because I've done a fair amount of radius on periosteum, like full strength.
Yeah,
I just don't see it
really
last the way I want it to last.
Wow.
Yeah, so I do think I know that cellulose component of it when they mix it up, it does give like that really robust like look to the people, and it's like it just seems like it goes away, and then you're just like, I feel like I'm just feeling a vault. What's going on? So then you pull out the lift, and I do feel like it kind of holds a little bit better.
That's funny that, that kind of segues into the other thing that we were talking about is the the biostimulants. Like, I feel like Sculptra is definitely more of like a builder, a collagen stimulator for restoring volume. But I feel like now hyperdilute radius has become more of a skin treatment, right? Don't you? I mean, is that mostly what you're using it for, Grayson?
Like a skin booster.
Yeah.
Like skin quality versus rebuilding structure.
Yeah. Where's the most common place you use hyperdilute radius?
I'm not using a lot of hyperduly
okay,
radius.
so-
We also didn't have that in Virginia.
Okay.
She's getting more familiar with it, but
Okay.
for me, I use it a lot in the skin for skin boosting,
Okay.
neck,
Neck, yeah,
hands,
necklines, yeah,
décolleté.
okay. Yeah,
I've done a
okay.
few bottoms, so some
Really?
gluteal enhancement with
Gluteal
it.
enhancement.
Does it work?
It works for, I think, better for skin quality.
Okay.
Now, there is a provider in Miami. I took her course. Like, she kind of patented this technique. And I think, like, in Miami, it works really well because, I think, you got to think about what they're doing. They're, like, walking around in a thong all the
Yeah,
time. They
yeah.
want to, like, and they don't mind spending the money. Like,
Yeah.
and they already have, there are a lot of Brazilian, a lot of South American, and so they already have kind of a nice shape. But it seems to work well for people who have had, like, not a botched surgical BBL,
Okay.
but like where you have some of the dimpling and things like that. If you can get that hyperduly radius in there and fill in those gaps,
Ooh,
it can
yeah.
really smooth some of that out for people, which is nice. And if you somebody that's got, like, cellulite, you can kind of subsize a little bit with like a cannula.
Yeah, really? Okay.
And then lay
Instead
down.
of ovally or something
yeah,
like that?
yeah,
Okay.
and then kind of lay down the radius to help, like, rebuild all of that again.
I love
It
that.
takes several. I mean, it takes a few
Takes a
syringes.
lot.
It takes a lot of syringes.
Yeah, I bet.
It's
Table's
not-
worth.
Yeah, very much so. I'm like, I hope this is worth it.
That's awesome.
Yeah.
Yeah, I think the bridge between surgery and non-surgical stuff, and even like skincare, lasers, all that
Yeah.
stuff. I feel like the way I think about it and the way I explain it to patients is you can tailor a dress perfectly
Right.
to fit a woman, right? But if the fabric is
Yeah.
terrible, you're kind of hosed. And
You're
so
right.
things like hyperdilute radius, laser resurfacing, like maintenance lasers, BBL, Moxie, Halo.
Yeah.
These things are all, I mean, they go hand in hand,
Yeah.
right? Like it's like you can do a facelift on somebody with terrible skin and it's
Yeah.
like a waste of money.
It
right?
is,
It's
yeah.
like horrible.
Yeah.
And so some people just don't get that. Like a facelift will never change
Right.
your skin quality.
Right.
And so starting early, doing all this stuff almost preventatively
Yeah.
is really the key, because you don't you age in every single layer.
Yes.
And you have to treat each of those layers, like the skin, you have to restore volume, whether it's with fat or something
Right.
else, bone volume, and then lifting the things that have dropped, like your SMAS and your platysma, and,
Yeah.
and doing all these things. It's like a very collaborative effort.
It is.
And patients sometimes don't get that, I think.
Yeah.
I think it's our responsibility to be able to be like, hey, yeah, maybe surgery is the right thing right
Yeah.
now. Or you know what? Yeah, you're not ready for surgery.
Right.
These are options that
Right.
you can try or at least explore.
Right.
But I think having a good relationship is everything.
Yeah.
You know, like because
Well, trust.
Yeah,
Yeah.
A
yeah,
lot of trust.
yeah, exactly.
I try to. I mean, I'm pretty upfront with people. I've just been doing this long enough and I'm like, this isn't going to be what you want.
Yeah.
I know in your mind that's what you think you want, but it's not going to work out for you. Cause,
Yeah.
this, especially under eye hollowing and
Oh my gosh.
upper lower breasts. We talk a lot about that with
Yeah.
patients, neck lifts,
Yes.
things like that. And everybody wants to put filler underneath their eyes. I'm like, it's just.
You don't put it?
Uh-uh.
Oh, I love that.
I know,
Oh,
no.
that's awesome. I love that. That's really good.
I just don't see the benefit of it. I
Yeah.
think that's about a 30% failure or 70% failure rate on it.
That's such a paradigm shift, because like 10 years ago, people were blasting filler into the lower
Oh my
lid,
gosh,
like
yeah.
tear trough. Oh yeah, put filler in it. And now, like, you should see the number of people I come in. I see that come in. They're like, they have a terrible malar edema,
Uh-huh.
like, and they're like, I'm like, oh, did you get filler? They're like, yeah, I got it like 10 years ago, but it dissolved on its own. I'm like, no,
it didn't.
your lymphatics are blocked. Like,
Yeah.
this is now a big problem. And so I saw you have ultrasound.
I do.
Do you dissolve filler with ultrasound?
I do.
I love that.
Yeah.
That's awesome.
Yeah.
That because you have to, right?
Yeah,
you have no
kinda
idea
have
what
to.
you're looking at.
Yeah.
And
And
you're like, yeah, tell me.
Well, the other thing too, I don't think people realize is like Halani is it degrades not just like HA filler, it's going to degrade all
Everything.
of your HA.
Everything.
And
Yes.
your natural HA is gone.
Yeah.
And so
Yeah.
then it'll come back, but it's going to take it some time and you're going to look really depleted there, And
Yeah.
so I do not like flooding the area because of that, So I try to be pretty precise with it.
I love
and
that.
like using a lot smaller amounts than probably other people would, but
Yeah.
unless there was that's a whole different
Yeah.
ballgame. But that's just
Selectively
yeah. That's a whole different thing. But yeah, the
Yeah,
whole
sorry.
I don't like. I hate it. I've done enough lips to see like what it does. I'm like, God, I gotta
That's
replace
great.
that back.
Yeah, that's so funny because like if somebody comes in and they're doing their lower eyelids and they have malar edema, I'm like, okay, I'll dissolve their filler for free.
Yeah.
Yeah.
Because I'm like, okay, you're gonna have surgery anyway. I'm
Right.
not trying to like nickel and dime you.
Right.
Like,
Yeah.
I just want you to have a good result.
Exactly.
And people appreciate that. They're like, you're gonna do it with ultrasound. You're like trying to do the right thing and develop a trusting relationship.
Yeah.
Because it's really easy to take advantage of people, and people do that all the time.
Yeah.
And it sucks to see when people just don't know.
I know.
There's people just taking advantage.
They
Anyway,
do. Yeah, I
That's a
typically,
different
I don't
story,
really
but-
charge people for dissolving either. Like I typically will, they're coming back.
Yeah.
They're going to come back.
Because you dissolve it and they're
And
like,
miss it.
oh my
Yeah.
God, where's all
And
my
they-
volume?
Yeah, they
Yeah.
need their volume back.
Yeah, yeah.
And a lot of times, like I've tried doing, and sometimes it works, is doing the PRP and then I'll turn it into like
You do the
biogel.
gel? Yeah, yeah, okay, cool.
And then replace the volume that's been lost. I'll put the biogel in so they have something to kind of bridge them
Yes.
through that gap of where they feel ugly.
It's hard. It's super hard,
It
right?
is.
Like you
It's-
do it and
yeah.
then they blow up for like 3 days
Yes.
as hyaluronidase does. And then they're like, I look 40 years older.
Yes.
Like, what did you do to
Yes.
me? And you're like, it's part of, you got to trust
The
the
process.
process. Yeah, trust the process. That's
Yes.
like the most important thing, I feel like, especially when you have like a staged intervention for somebody. You're like, please, I do this all the time.
Yes.
Just believe me, it's going to be fine.
Yeah.
That's hard.
It is
That's a
hard.
hard conversation to have.
Yeah.
Yeah.
I think people looking at themselves in the mirror a lot is like very hard for them to decipher like what's going on. I call
Yeah.
it like a perception drift. They just really, I think I read somewhere it takes like sometimes 6 to 8 months to really see changes in yourself. Yeah.
Yeah.
For the person looking in the mirror, other people see it. But
Oh, yeah,
like, you're
immediately.
the
Yeah, yeah.
slowest one to see it. And so I was like, gosh, it sucks.
Like pictures are so important
Yes,
too.
that's why pictures before and after
Oh
are
my
so
gosh,
important.
yes.
Yeah.
I had this 22-year-old girl come in once, and she was way over injected, overinflated, and she's like, "Oh, I want a lip lift."
Oh,
I'm like, "Okay, have you like thought about maybe dialing back the lip filler?"
yeah.
She's like, "No, why?" I'm like, "Have you heard of filler blindness?" And she looked at me like I just killed somebody in her family. She's like, "Are you saying I have filler blindness?" And I had a resident with me at the time, and she was like, "This is uncomfortable."
Yeah.
And I'm like, because you just don't see it,
No,
right? Like
you
you're
don't
looking
see
at
it.
yourself every
Right.
single day,
Yeah.
and it's your face. It's not like something with your breast where you can put a bra and shirt on, but like
Yeah.
the first thing you do is you go,
You wake up, you look in the mirror,
That's the
and
first thing you
You're
do.
used to it.
And yeah, exactly.
Yeah.
Yeah.
And so being able to have hard conversations is, I feel like, a really important part about what we do.
Yeah.
Yeah.
And building that trust is the only way I think you
Yeah.
can have them.
No, it is. It's a journey.
Yeah.
Every day,
Right?
I'm
Yeah.
like, okay, who do I have to tell no to today?
Some days are harder than others. Some days are harder than
And
others.
I have good distractions here. I'm like, well, why don't we laser? Well,
Yes.
let's do
You
a miso
are
needle.
a good segue.
I'm like,
into
let's
something
go over
else.
here and let's distract you for a little bit.
I love that.
Yeah, let's do an IV or something. Get in a red light bed.
Yeah, get some NAD going.
Yeah, let's do an NAD infusion. That would be great.
I like the red light tanning bed.
Oh no.
Yes.
Is that like is
Well,
it an actual tanning bed?
it's not a tanning bed. It's just a red light bed. So
I
it's
see.
got like 19,000 LED lights in it. Yeah. So it is quite blastful. But it's got all the 3 different wavelengths for,
People get in that thing naked?
yeah.
You're
Wow.
supposed
Well,
to.
you're supposed
Really?
to. You're
The more
supposed to give
skin
yourself-
exposure.
Yeah, all the exposure.
Wow.
And it's kind of like complimentary to like people. It's a good buffer for us.
Really?
Like
Yeah,
when you're
okay.
running 15, 20 minutes behind, you can put them in
Yeah,
there.
pop in.
Or
Oh,
they're
that's so
numbing,
smart.
or like,
Yeah.
you know what I've done recently is because my Triberts, I numb them for an hour in Halo. I'll have
Yeah.
them sit in that and while they're numbing, because it's so boring to numb.
Yeah.
And so I'll tell them just do 30 minutes. You'll have to get out and hit the timer again and get in it. But maybe I'm crazy. I swear they
it work?
heal so much better.
Really?
They don't even look like sometimes they had the treatment done. And I'm
Really?
like, is this thing working? I have the
Yeah.
settings up pretty high.
Wow.
And they leave. But I mean, the swelling sets in later. But
Yeah.
I do think they're recovering faster.
Really?
Yes.
It's like you after your tribrid.
I know.
Did you try bread yourself?
I was one of the models Grayson
Yes.
did me.
Oh, nice.
Yeah.
She looked beautiful the next day.
Really? How long were you in there? A couple hours?
I probably do 30 minutes.
Do you sleep in that thing?
I would like to.
Yeah.
If I
Fall
could,
asleep
I would.
sometimes.
Do you?
No.
Oh.
Have you even done
There's
it?
some naps. No, I haven't even gotten in there.
What?
I need to be doing it
I
at
know.
least once a
Sometimes I'll
week.
try to get here early, so I'll just like
a
jump
good
in
idea.
before the day gets going.
Really?
Yeah, and then
Is it hot?
no, that's the thing. There's no
Okay.
infrared in it. It's
Okay.
just LED, and it has a little fan if you get hot, but I never get hot.
Wow.
Yeah,
That's incredible.
yeah.
I like
I
that.
feel like it helps my joints. Like maybe I'm crazy, maybe I'm not. But if you read the study, there is like a few
Are there?
published. Maybe that.
Okay.
There's
The
some
data
things-
I saw was
if
sort
I
of
googled
like
it, I find
okay.
some things.
Sometimes,
I don't know if they're from the
maybe.
United States
when the
or
moon
from
is in
Korea.
retrograde, Mercury's
Yeah.
in retrograde.
Yeah.
Interesting. Okay.
Yeah, but it was like you should, if you're gonna do it, you need to do it every day. And I think that's more for like the red light mask.
Okay.
But like this stuff, I think is pretty. If you can front load yourself a little bit, I think it's kind of like doing a NAD infusion. You're gonna turn something on, and you just needs to like, how long is that gonna stay running optimally until it crashes again?
Yeah.
That's pretty cool.
Then you
Yeah,
get
cool.
back in it again and just kind of recharge. I
Yeah.
feel like it's like Superman, like I'm in sun.
Okay, tell me about the Zerf.
Okay. Ooh,
Amber?
here we go, Amber.
Well, I was talking to her about it earlier.
Yeah.
A lot of it's very new to me.
Well, it is new because it's
Somebody
Korean.
keeps coming to my office to try to shill it to me, and I'm like,
I know it's.
I need to do my homework first.
I know.
It's
well,
hard
and
to
the
new
problem
stuff.
is they don't have a lot of published data in the United States with it because
Okay.
it's a Korean machine and Cynosure or Lutronic bought it.
Oh, it's owned by Lutronic?
Yes.
Oh,
Yeah.
got it. Okay.
And so its claim is it's a monopolar radio frequency. So it's a dual frequency.
Okay.
So you're getting it at 6.8 hertz. 6.8 and 2 hertz.
Okay.
So you're getting 2 treatments. Plus it's sending in like a cryo like coolant at the same time. So it's like heat, cool, heat, cool.
Okay.
And you can kind of pick like the depth that you want to treat. So you can go, deeper in some areas, more shallow in other areas. And then like it's set up to like deliver a certain amount of, is it hertz? No, not hertz. Is it joules per minute? Joules per something. Like every
Joules
time
per
you
meter
run it,
square?
it's like you can meet 75 or you're at 85. You want to make sure the heat stays at that.
Joules per second?
Yeah. Like some are 150, like wherever you've got it. And I can't remember what it is, but that's kind of the key behind it.
Do you like it?
And I do like it. We haven't had enough patients have that second treatment for me to be like, this is really good and everybody needs to do it. I like that it complements biostimulators really well.
Oh, it does?
Oh
So
my gosh.
So you inject them and then blast them with that
Well,
thing?
we have not actually done that just yet, but I've done it where like they've had their Sculptra like 4 weeks prior and they come in and they get the Zerf, and I do think that they are they plump faster
Really?
than the other patients will. And then some like we've done an IV. It's again a very like it's water. We're looking to like heat all the water up, and so I feel like giving them an IV helps. And then like the more hydration you have in your face, the better the treatment.
You're gonna look full. Yeah.
Like everything.
I get it.
I haven't done the CO. I think thinking back, I think maybe that CO2 mask might be kind of beneficial before and then you do it. I don't
Like the carboxy mask.
the carboxy mask.
Yeah. Okay.
Yeah.
Do you like that? You use that?
I do because
Really?
well,
love it.
so I know. So
You
Lana,
got all the tech.
I
here.
know.
This is like
Yes.
awesome.
I
love
read
this.
See
about
what drew me here.
Yeah.
I read about stuff a lot. I know the Lana, she created that brand and she gives me good feedback on stuff. And she says there is a paper that was coming that's saying that if you use the CO2 mask post laser, they're actually seeing more dermal thickening versus the patients who are not using it. And so what I have done a few times is put it on while they're numbing.
Okay.
So just kind of, because it is like,
You mix it with your jelly or whatever.
I just put the numbing on and then I put the mask on top of it because it is like a topical delivery system as well. And so the patients seem happy. And again, like they do look like they respond better to the laser. Yes. So I'm like, when evidence is in front of you, you seem to have to like follow it, right?
I guess. Yeah. I love it.
Yeah.
You really are like very
I try.
avant-garde with all this stuff.
I
You're
try
like
to be.
a trailblazer.
I'm trying to keep it all like evidence-based as much as I can.
Yeah.
And not trying to sell a bunch of stuff that just gimmicks. I don't want to do gimmicks and
No,
things
I mean,
like that.
I see all the stuff you have. I believe in all this.
Yeah.
Except the Zerf. I don't know about
I
the
know,
Zerf
well,
yet, but
listen.
I believe in your tri-braid halo situation. I think that Sciton knows what's up.
They do know what's up.
Yeah.
Free plug for Sciton.
I know, right?
Free plug.
They should give us
Always.
a free tribe.
They should give us a free tribe rate.
On the house.
Our house.
Yeah.
Yeah.
Yes.
I need a whole
Yes.
laser house.
An
is what I
at-home
need.
tribe.
Yeah.
At home. Can we get the tabletop tribe rate, please?
Especially a BBL at home.
That would be great. I'd be in
Skin
there
smooth
every day.
Oh
Wake up every morning. Who needs a gua sha when you can just BBL
Just
your
BBL the
face?
hell out of yourself.
Oh my gosh.
Get a
Okay.
clear
There's
silk.
energy in.
So did you get to see me use the CO2?
I didn't get to see you do
Oh, yeah,
it,
okay.
but I know you had it.
Yeah. So my preference is erbium. Do you have Contour TRL, right?
I do.
Yeah. Okay. I love Contour TRL. That's what I trained on. But I have a Deca. I use that Deca CO2,
Yeah.
which is fractionated CO2. I don't have a ton. I mean, I don't have a ton of really dark or like higher Fitzpatrick patients.
Okay.
But I do find that the fractionated CO2. Okay, I find that the fractionated CO2, and I treat pretty aggressively. Like I get to paprikash, pinpoint bleeding.
Yeah.
The post-treatment hyperemia,
Yeah.
I don't have a lot of that.
Oh,
or
good.
the erythema. Like I feel
Interesting.
like with Contour TRL, I used to have
You get a lot of
3
it.
months
I know.
Yeah.
of red,
You do.
and patients hate that.
They do hate
Yes.
it. I have to talk to them off a cliff
Off a ledge.
all the
It's
time.
so hard. And
I
so-
have to. Some of my providers I have to talk off the cliff because
Yeah.
they have it.
Right.
Yeah.
So the thing I like about the Deca CO2 is that I never have that issue, but I do find that my results are a little lackluster.
Okay.
And so it's a trade-off, right?
It is.
It's like
Yeah.
people want to get back to normal
As
faster.
fast as they can.
Yeah.
Mhm.
And like they don't trust the process.
No.
Right.
And I think that
Instant result.
you're
Yes.
like, I want to look good now.
Yeah,
No,
like,
I'm
I
okay.
had surgery and I've got like I'm getting married in 2 weeks.
Yeah, I'm like, yeah, you're like, I need to go.
Oh, awesome! Can't wait. This
It's
would
like
be
that,
fun.
What are my top 5 horror movies?
Yes.
That
yes.
is it.
Yes.
That's one.
Yeah.
There was a patient that like, she was like, my son's getting married in 3 weeks. I'm like, lady, I'm not doing your facelift.
Yeah.
You're not going to look good. She goes, can you show me pictures of what people look like at 3 weeks? I'm like, sure. And I'm like, look, this is not good. She's like, no, that looks good. I want that.
Oh
I'm
my
like,
gosh.
no. I ultimately did it.
I was gonna. Did you do it? I was gonna ask if you did it.
I caved.
You did.
I
Bleed
caved.
into
Yeah,
it.
I sure did. And she looked great. She just wore her hair down. I'm like,
Yeah. Well, somebody like that, they're gonna follow every post-care instruction you give them,
Yeah,
and they're
that's
gonna
true.
like be so compliant. They're gonna do probably the extra work.
she was on it.
Yeah.
But anyway, the CO2 I think has less downtime, but less effective in
Yeah.
terms of treating static rhytids
Right.
and like really bad actinic damage.
Uh-huh.
But I think the Contour TRL, that's like, I mean, it's the
Yeah,
Cadillac.
it's the
I love
Cadillac,
that
yeah.
thing. It's great.
Well, there's a lot of debate like on the social media about that because there's just so many surgeons who are one way or the other.
Really?
Yes. And the biggest thing that I keep kind of seeing about CO2 laser is that, yes, it's going to have more thermal injury beyond the area that you're treating
Sure.
because it's so hot. But now they're saying, some people are saying, well, that's going to give you more like deeper collagen production and skin changes. And
Yeah.
I just wondered, like, do you think that's...
So here's the deal. So like immediately, and I'm sure you guys have seen this on Instagram. Somebody like,
Yeah, you can see the
CO2 is the lower
skin.
lid.
Oh my
Yeah,
God,
it
you can see the
tightens.
skin just like, it looks like
Visibly,
chicken, like raw
yeah.
chicken when you hit it with flame.
it's because the
Yeah.
chromophore for CO2
It's
is
water.
water,
Yeah.
right? It's got a wavelength of 10,000 nanometers.
Yes.
Like that is, you
It's-
can't set a depth,
Yeah.
right? You're just blasting everything
Uh-huh.
away, right?
Mhm.
And so that's why there's a higher risk of hyperpigmentation with CO2. With erbium, you can set the depth
Yeah,
to like the 100 or 50
yeah,
nanometer
yeah.
or microns,
microns,
right?
yeah.
And so I feel like it's way more precise.
Yeah,
And your risk of hyperpigmentation with Contour TRL or erbium or something where you're setting the depth and not just delivering
yeah.
joules
uh-huh,
is way better.
yeah,
And so 10,000 it's just not fair.
Yeah.
Because yes, when you blast the water out of skin, it's going to tighten
yeah,
because we're like 80% water.
uh-huh,
So yeah, I don't buy that.
yeah.
I don't buy that
Interesting.
I know.
because
Yeah.
I think if it were up to me, I would only use Contour TRL,
Uh-huh,
to be totally honest.
right.
So if Saiton wants it.
Yeah. He's looking for one for his office.
No, but no, I don't think that's fair.
Yeah.
I don't think so.
Now that's kind of what the argument I've been reading about has been, is like, well, there's much more thermal injury, so it's going to be like you're going to get diffuse.
That's not a good
heating.
thing, though. Yeah, that's
okay. Well, it's like that'd be like radio frequency microneedling and heating beyond where you want to treat. I don't think that's good.
Yeah,
but I do agree. The redness is legit. Like post.
What do you do for it?
Well, typically, I'll bring them back and BBL them. Or clear silk them.
That's perfect.
Because I've got I have the recipes. You know, I've got all the modalities that we can kind of combat that.
You know something?
Yeah.
Or you can do like a short-term clobetasol.
Yeah,
you know,
and I've never played with that. Yeah, because I don't trust people.
Because then they'll keep
like,
using
I
it.
used the whole tub. I'm like, it's cool.
Yeah,
that's,
for 3 months, and you're like,
I mean,
your skin is like water.
Or
wafer
save
thin.
it at home and use it another time.
Like snorting it. You just never know. That's smart. The BBL is a great. I mean, that's like a great supplement for that, which I love.
Yeah,
that's good. You got ways to combat it.
I kind of have, and what I've also been doing lately is so BBL Heroic has the new 640S filter, which is Dr. Bitter created that, Patrick Bitter. And so at the end of like, if I do a BBL prior to Halo, which I do more of that. I try not to go ham on the BBL because I know Tribrid's going to pick up the rest of the pigment, but I'll end the BBL with the Skin Smooth, which is the 640S. And I don't know if it helps calm down in my mind, I'm thinking it does, but that's just because I'm like trying to combat redness. And I'm like, I'm willing to throw anything at the kitchen sink at this point because the complaints is like, it's not terrible, but you're just
it's enough to be like,
it's not, you're like, I did this and I need to talk them off the cliff, but it's like, when
like
you're doing it like every
shoe.
week.
Patient selection too. You can't just do it on anyone. I feel like you have to thoroughly explain what's going to happen and do it on the right person.
Oh my God. Yeah. So when I used to do contour TRL when I was at UT Southwestern, I had like a book and it was like, this is what you're going to look like day 1, day 2, week 1, week 2, week 3, week 4. And I'm like, you have to be ready for this.
Scare them into it.
Yeah, because I'm going to burn your entire face off and you're going to hate it.
Yeah.
And they're going to be like, well, can I go out in the pool in the sun? I'm like, no.
You're missing our conversation here.
Why do you hate me? It's so painful.
I know.
And, but yeah, you like patient selection is everything. They have to be ready for an absolute beating.
Yeah.
And you get through it together, right? It's like a team effort.
Hand holding.
A lot of hand holding. And then do you do vinegar soaks?
Yeah. So
what do you think?
We like them, but what we have is Zeo has an astringent powder.
Oh, really?
It's like basically your vinegar.
Okay.
But it's got,
plus
like
extras.
oat stuff in it and some other things in it to kind of help calm down some of the inflammation.
Or something.
Yeah. So we use that. But the biggest thing is just like, wash your face. Like you got to get in a shower.
Yes.
You can't like washing your face in the sink's just not going to cut that. You got to get in a shower and wash that off. And I had a patient did it and she looks so good because she followed the instructions, which is so nice.
It's rare.
It's rare.
It's so
but she's also, been my patient for over 5-6 years. She gets it. And this was like the next step. Like this is, you hate your wrinkles around your mouth and you're only like 55 years old. Let's do this now.
Yeah.
So
I love that.
She loved it.
Blast them off.
Yeah, we blast her.
Did you? Yeah, that's so good.
Yeah.
What depth do you go when you do perioral? What do you like 600-800?
Yeah, well, I'm probably not as brave as that. But I think I did because I like to do like multiple passes at like like 150 or something, just to just
at a time.
Yeah, little layers at a time. Just we'll take that layer, take that layer, and just kind of watch
until you reach
bleeding.
a layer where you're like, maybe
it's bleeding a little bit too much. You line chase?
No, I did burns.
Yeah.
Yes,
He's
and
crazy.
I know it is crazy, and it's a little scary.
Very scary.
Like I feel like he can do that.
Yeah, I mean, even watching him do it, I'm like,
I know he's so fast.
Oh my God, yeah.
I know he's like,
but then he goes after those individual lines.
Yes,
I'm
like, oh my gosh.
Burns. My sphincter is very.
I know.
tight.
Like I'm like having anxiety.
The surgeon I worked for, that's the way he used TRL, and he got really good results from it, and was super confident of treating everywhere, and then going in and hammering those lines until they just disappeared.
I mean, it works. It's just like
the aftercare of that too. Yes. You have to have a brave patient to wash that area.
Yes.
Yeah, it's not pretty.
Yeah.
But it's good.
Heals really pretty after
It
that.
does.
It does. It heals beautifully. Once all that redness goes away.
Yeah.
Yeah. That's good.
Yeah.
Is there more stuff?
Yeah, there's all
This
types
is
of
very
stuff.
good.
I know.
I feel like we got a
He
good,
was
we got a
texting me
good
some
vibe
prompts.
I know. You texted me prompts.
Yes, which we kind of talked about. A prompt was, how do you pairing these skin devices, like all of these lasers we're talking about
Yeah.
and injectables, with your facelift patients? Are you doing or requiring your surgery patients to do some type of skin prep treatment, whether it's a laser or skincare at least?
Yeah, so that's a really good question because skin is everything.
Mm-hmm.
And so all patients, all patients that come in, I give them all a prescribed skincare, whether they have surgery or not, because ultimately you want to do the right. I mean, I'm a doctor. I'm still trying to do the right thing for this patient,
Right.
whether or not they want to have surgery with me or not.
Uh-huh. And
And so I feel like it's a duty. They went out of their way to come here.
Yeah.
And so like, for me, it's like, yeah, this is something I can do besides saying, oh yeah, this is a surgery I would do.
yeah.
So every single person gets, and it's not like I'm trying to make money off it. I'm like, okay, you need a sunscreen,
Mm-hmm.
you need a vitamin C serum, you need a retinol, and you need hydroquinone.
Yeah.
And I'll write the prescriptions for the hydroquinone and the retinol. I'm not trying to shill them on what we have in the office, which is fine because like you could, but for me, it's like, it's wrong.
Uh-huh.
I'm like, yeah, it's like $12 with your insurance. Just go get it there.
Just go get it, yeah.
But I do like the CE Ferulic, the SkinCeuticals one.
Yeah.
I love that. I feel like it's expensive, but that's like, I think it's really good. And that's it. So they all have to be on that. If they're getting surgery, they have to be on all those because if they're getting a facelift, 95 to 99% of the time, I'm doing a laser at the same time.
Yeah.
So they have to be on all those. And then when they sign up for surgery and they're getting a laser, then I give them this skincare package of like a bunch of elastin stuff for pre and post.
Okay.
And it's all included. So yeah, I think taking care of skin is everything. And so a lot of people neglect it. And the earlier you can be doing it, the better, I think.
Yeah.
So yeah,
Especially for healing, I'm sure too. Those scar areas and
the face heals really well.
Yeah.
For the most part.
No,
I mean,
it
as you
does.
can see, when you blast them with this laser, they do great. But yeah, I think, I think I would never do surgery on somebody that had bad skin and not offer them something.
Yeah.
You know, it's just it's not fair.
Mm-hmm.
not treating them as a whole.
Yeah.
And just like you said, I think it's kind of hard there's a line of feeling like you're overselling them, or maybe you don't want them to feel like you're, adding all these things on.
Yeah.
But it is a better outcome if you do. And sometimes it's worth not even having a treatment if you're not going to do XYZ with it, or good post care even.
Oh yeah. Like being a plastic surgeon, it's funny when you're in training, when you're training to be a plastic surgeon, they tell you this, that like learning how to do the surgery and doing all that stuff, that's fine. Like you'll learn that. But then when you're in practice, it's knowing when to say no.
Mm-hmm.
Yeah.
It's like this person has a wedding in 2 weeks.
Yeah.
And I want all this stuff. I'm like, yeah, I would love to help you, but that's not the right thing to do.
Mm-hmm.
And it's like knowing that somebody's not going to follow skincare stuff or not be totally invested, it's a waste. And so like, it's a journey you go on together where you're like, this is an all-in thing.
Yeah.
Like, you'll never be abandoned. Like, we'll get through this together. Everybody in this building is dedicated to making sure you have a good result.
Yeah.
But you have to buy into, like,
Right.
you have to be all in.
Like you have to be in with us.
Yeah.
Yeah.
Yeah. And so it's like it's a very all or nothing deal.
Yeah.
Mm-hmm.
Can't pick a la carte.
Yeah.
Well,
People
why
want
not?
to.
I know.
People want to, but I don't want to do that. Oh, it's
I know.
okay. Well,
They're
then
still
I'm not-
unhappy at the end of
Exactly.
Yeah, at the end
Just
of the
go
day.
home and save for it and come back
Yeah.
for the whole shebang versus pick and choose.
I'm so bad. Like, I'll have my patient care coordinator give somebody a price. They're like, I can't afford all that. And I tell her, I'm like, just tell her to pay whatever she wants. I just don't care. Like,
Yeah.
like,
This
I would,
is exactly
right?
Amy.
right. I'm like, I would rather you have a
Yes.
good result
Me too.
Yeah.
than you go around with like only a facelift.
Yeah.
And then you're like, but I don't want the neck lift. I'm like, listen, Just I'll do all of it.
You know what? I'll just do it for free.
I'll
it's your
just do it
name.
for free. I don't care.
Yeah.
Because you're gonna go around and people are gonna be like, "Who did that to
Right,
you?"
Exactly.
Your name's on their face.
Yes.
My artwork. I need
Yes.
you to like look presentable.
Yeah. I'm
Yeah.
like, I don't want you going around telling people that, yeah, he only did my upper lids and
Yeah.
lower lids, but not my brow or the laser. I'm
Right.
like, no, just
That's
do
not-
it.
yeah,
It's
I'll just
okay.
do it. It's
Whatever.
fine.
Yeah.
Yeah.
It's okay.
It's just my time right now.
It's just
okay.
time and
Yeah,
money.
it's
and
fine.
You can always make more.
Yeah, it's fine.
It's okay.
I just went to school a long time. It's
Yeah.
okay.
No, but right. That's like they go around and they're going to tell, people
Talk
are going
about
to
it.
ask,
Yeah.
where did you go?
Yeah.
Who did this to you?
Yes.
Or, oh my God, where did you get this done?
Yes.
You know,
Yeah,
you
there's
don't-
two ways to look at it.
And you don't want the first one.
Yeah. You do
did
not.
that
Ooh.
It's a disservice.
Yes.
Yeah.
Yeah.
I ran into this a lot with, when I worked at my plastic surgeon office, someone would come in for a facelift consult
Yeah.
for surgery, talk about it. They're a great candidate for it, but for budgetary reasons decided not to.
Yeah.
Maybe for now, maybe forever. And so instead they'd book an appointment with me and leave me to, they have this goal in their mind. They're doing things like
Yes.
this.
Yes.
And that's anytime I see someone doing this, it just makes my heart sink a little bit for what I can do for them.
Yeah.
Because they've come in for a consult, they have a goal in mind of what they want to look like, and it's surgical.
Yeah.
And there's only so much I can do. So then I'm left with, pulling these random
So
things,
hard.
especially if they're never going to have a facelift that's just not in the budget at all.
Right.
How do you bridge that gap of someone who's a really great surgical candidate who will never have a facelift because of budget? Are they just out of luck?
I don't think they're out of luck, but
No.
it's really hard because it's like, a facelift is expensive.
Yeah.
Like there are ranges of
Yeah.
everything, but it's like, it's your face.
It is your face.
Like if you're going to invest in
Yeah.
one thing, you should invest in that.
Yeah.
And like, I see a lot of people that come in, they're not sure what they want, or like, I look at them like, oh my God, they'd look so good if they got a facelift.
Uh-huh.
Yeah.
So every single patient that comes in, I have an exam chair and I can lean it back and forth. I put them in the exam chair, I have them hold a mirror, and I lean the chair all the way back.
Yeah.
And I have them
'cause,
tilt
like,
their chin up.
Wow.
gravity.
I'm like, do you like the way this looks?
Yeah.
They're like, oh my God, I love this. I'm
Right.
like, that's
Okay.
a facelift
That's
and
a
a necklace.
facelift.
Yeah.
They're like, okay, I guess I'll do that.
Yeah, that's
Because
a
then
good
you
way to look at
you
it.
can tell them, be like,
Yeah.
it's hard for people to visualize. Like, what are you going to do to me?
Right.
Like, what is it going to look like?
Yeah.
And then I just lean them back.
Yeah.
Yeah.
And like, they're like, oh, I love this.
yeah.
But then other times people are like, yeah, I love it, but I don't want to go through all this.
Right.
And I think there you can go down the skincare route,
Mhm.
right? Like get them levered all
Oh,
the way
yeah.
up
Mhm.
on skincare, like
Yeah.
everything, Tribrid,
Yeah.
whatever
Whatever
you
you
can.
can.
Yeah.
And they're willing to pay for it.
Yes.
And
And it's more, I mean, it's
It's-
slightly more manageable
Yeah.
than a facelift,
it is.
Less scary, maybe.
Yeah.
less scary.
Under
yeah.
the knife. I mean,
yeah.
just
That scares
Right.
people.
Uh-huh.
And the other thing I've noticed is like a lot of people don't know what a facelift is. Like
yeah.
they're like, I don't want a full facelift.
Oh, yeah. That happened to me yesterday.
Did it really?
Oh, yeah. She goes, I don't want a full facelift.
Just
I
a
just
mini."
want like here.
Yeah.
I'm like, Alicia, that's a full facelift
Yeah.
and a neck lift. So
It's funny because people think a full facelift is like an incision that goes all the way around
I
their head.
know,
I'm like,
right.
that's
that's
not
not
what this
it. No.
is.
Yeah.
But that again, it's like educating.
It is.
And they're like, oh, I just want a mini facelift. And I'm like, what do you think a mini facelift
What is a mini?
Mhm.
Like, really, what is
Yeah.
what is a mini facelift?
Okay.
Like, this drives me
What
crazy.
is it?
Okay, so for me, I try not to use the word mini,
Okay.
but historically, what a mini facelift is just an incision in front of the ear
Mhm.
that just lifts this.
Okay.
In reality, it's nobody's a candidate for it.
Right.
It's like not a real thing.
Okay.
Usually, other times, what people will call a mini facelift is just skin,
Uh-huh.
and it's like, oh, it's all the same incisions, but we're just lifting the skin.
Well,
Mhm.
that didn't fix the problem.
It doesn't fix the problem, right?
Yeah,
That's
For
the
how
thing.
long?
Yeah, exactly.
Yeah,
It's like you
a
just
year.
pull
It's
on their
gonna
skin as
drag.
hard as you can. They end up with these really wide scars.
Yeah, they do. I've seen it.
Yeah,
Mhm.
people want a shortcut,
They do.
and I say this and it's so bad. It's like mini facelift, mini result.
Right.
Yeah.
Like that, you're not going to be happy.
Mhm.
And if you're somebody that needs a mini facelift, you don't need a facelift.
Yeah.
Like ultimately, that's really what it is.
Right.
But yeah, to me, I try to never use that word.
Uh-huh.
Or if they're like, I want a mini facelift, I'll be like, okay, well, this is what a mini facelift is. And I'll just describe my operation,
Uh-huh.
which is a regular facelift. They're like,
Mm-hmm.
oh yeah, that sounds
Perfect.
good. They're like, that sounds good.
Oh, good.
You know?
Yeah.
Because they don't know. They just hear
Yeah.
that word mini
Right.
and they're like, oh, okay.
Yeah, that sounds good. Yeah.
Sounds great.
Yeah.
Okay.
I know she and I have well, she's kind of a mutual patient who had a mini neck lift and facelift. And I looking at her, I don't know what she had done. And I don't even, she went to somebody in Dallas. I don't even know who it is. And it's just, but it's not like she's not the first patient that goes to these places. And I'm just like,
Younger.
what? Yeah, they're younger. They're like speaking to people. And I guess the price is like, what, 15,000, 20,000. But still, I'm like, that's a lot of money.
That's a lot of dough.
It's a lot of money to put
Keep
towards
saving.
a result
Keep
that's
saving.
probably not going to last you more than a couple of years.
You know, it's funny that the other thing is like we were talking about heavy necks
Uh-huh.
and like submandibular gland contouring. Like there'll be people that come in and it's like somebody that's never had a jawline,
Uh-huh.
right?
Yeah.
And they have these really heavy necks, large submandibular glands.
Yeah.
Like I just want submental liposuction.
Oh.
I'm like, okay, I promise you, I'll tell them, I'll be like, okay, this is not going to make you happy.
Uh-huh.
I'm happy to do it for you,
Mhm.
but you're going to be unhappy.
Yeah.
And I got burned on that.
Oh.
And so now if somebody's like, I want submental liposuction,
yeah.
I'm like, that's not the operation you need.
Uh-huh.
If you want to do it, you should go somewhere else.
Yeah.
And this was literally like 7 months ago. This woman was like, okay, well, I'm just going to go get submental liposuction. I'm like, okay, but when you get it and you come back,
Uh-huh.
I'm going to charge you triple
Yeah.
because I told you
Yeah.
and you went somewhere else.
Right.
And she started laughing. I'm like, I'm not totally joking,
Right.
but I'm telling you, you're going to be unhappy.
Uh-huh.
Yeah.
She literally came back last week.
Oh, yeah.
She's like, you were right.
Of course.
Wow.
Can you do because you're like, this girl's like 34.
Oh,
She's a
right.
nurse.
Yeah.
And she's like, no, I don't need that. I don't need a neck lift. I'm not that person. I'm like, okay, fair.
Mm-hmm.
And then she comes back. I'm like, look, these are your glands. They're still there.
Right.
Liposuction doesn't treat that.
And it shouldn't.
yeah. I mean, oh my
Yeah.
God.
Please.
Oh my God. And I'm like, listen, this is what you need to do.
Yeah.
Like, she's like, okay, fine.
Oh, good. So here's a good question. Can somebody have just a neck lift?
Yeah.
Okay.
100%.
Okay.
It's got to be the right patient.
Yeah.
So I would say my indications so it depends on what you mean by a neck lift. When I think about just a neck lift in somebody, it's somebody typically young, like 40 or under,
Yeah.
that has full submandibular glands, like a lot of deep neck volume.
Okay.
And that's it. No
Okay.
facial aging or anything else.
Yeah.
So small incision underneath the chin, debulk the glands,
Mm-hmm.
debulk the digastric muscle, take out a little bit of fat, close it up. And then I do make an incision around the ears just to tighten a little bit. And then anytime somebody gets a deep neck lift, when you take out the submandibular gland, I put in drains.
Mm-hmm.
Mm-hmm.
So the drains stay for 5 days.
Okay.
The submandibular glands produce saliva.
Mm-hmm.
They're one of 9 glands that produce saliva. We just contour some of them, not take the whole thing out.
Yeah.
But after surgery, I put them on a bland diet for 2 weeks.
Okay.
And I have a list of stuff they can eat
Uh-huh.
and can't eat, and they hate it. But I'm like, listen, the glands are going to sweat
Yeah.
if you eat any of these things because it's going to make your mouth water.
Yeah.
And so the drain sits there and tries to drain out whatever fluid those glands produce.
Uh-huh.
But it's like, this is like a serious thing. I'm
Yeah.
like,
Yeah.
you need to be committed to this and like not drink alcohol, nothing
Yeah.
spicy, nothing sweet. And I would say those are like my happiest patients
Yeah.
because they're young,
Mm-hmm.
they've got great skin. Like
Yeah.
And
you're
it's-
just taking the bulk out
Yeah.
and everything sucks back down.
Right.
And it's like, I love doing those cases.
So
So
many
good.
people ask about just this
Yeah.
area.
Oh my God.
And it's not, I mean, a good weight. It's not like it's just what they call genetic. They've always had
Yes.
it.
Yeah.
100%.
They lose weight. Oh, it still stays there.
Yeah.
What can I do for it? I'm such a skeptic when it comes to most things, especially in the neck.
Yeah.
Someone's like a tightening device. Like we had Morpheus at my last place,
Yeah.
even Zerf and some of these. I am such a skeptic when it comes because
Really?
a lot of people are doing this or
Uh-huh.
pointing here.
Yeah.
And yeah, it's just, that's the fix all.
It's hard.
It is hard.
It is the fix all, but it's also like, it's not without risks, right?
Yeah.
you're going under the knife.
You are.
You're going to have an incision.
Uh-huh.
There's a lot of important real estate
There
in
is.
this area.
Yeah.
And, there's not a lot of people that take out glands.
No, there's not.
It's
like another hot topic.
Yeah. It's
Yeah.
like people that's the other thing. A lot of people won't do it. They're like, it's too dangerous and all this other stuff. But for me, I was really fortunate enough to learn this operation really, really early on in my training. And I feel very comfortable doing it.
Mm-hmm.
But a lot of people don't. And I feel like the controversy is from people that don't know how to do it.
Right.
Or don't feel comfortable doing it.
Yeah.
But I think there are a subset of patients that won't be happy unless you treat the bulk
Everything.
and the submental.
Yeah.
Yeah. It's
Everything.
an all or nothing thing. You
is.
can't just do submental lipo.
Yeah.
Just anyway. But I think it's an interesting topic, especially now as more people learn about it.
Yeah.
But you got to treat the problem.
Mm-hmm.
I think.
No, I like that.
So you'll do a neck without a face.
Yes.
Are you ever doing a face without a neck?
Never.
Okay.
Never.
Yeah.
Yeah, I don't think there's an indication for that. Because your whole face ages globally.
Yeah.
And the isolated neck lift is not an aging problem, it's an anatomy problem. And so there's no time where the face will only age and the neck doesn't.
Right.
Mm-hmm.
So that's a good question.
Yeah.
But yeah.
And then typically brow lifts with most of your facelifts.
Almost all of them.
All of them.
Mhm.
Yeah.
Yeah, that's been an evolution in the last year or so. But yeah, I feel, when you lift like this, you're having this pleat here.
Yeah.
Yes.
And the only way to get rid of it is to work everything out.
Yeah.
And as you saw when you came to visit me, the first thing I do is the brow lift because I know that you can't overlift the brow.
Yeah.
And so once I know that this is up, everything else will just kind of work its way out. Yeah,
needs to go.
exactly.
Yeah.
And so, the brow, I feel like, you have to treat everything because the probability of them not having a brow problem is really low.
Right.
And so even if, like I was saying, when you lean somebody back, their brow also goes back.
Yeah.
All of these things go together,
Uh-huh.
and we fight gravity with surgery. But I think almost all patients need some sort of brow intervention.
Yes.
This pleat you're talking about, seeing it just makes me so mad. It's almost like seeing a Spock brow at the airport.
It's like,
oh, I could fix that.
it's like,
I know.
or like,
Little
why didn't
pleat.
the surgeon
Right.
complete that surgery the right way?
Right.
Yeah, it's hard. It's hard. But that pleat usually goes away. But if somebody's really against a brow lift, I mean, there's only so much you can do.
Yeah.
Yeah.
But it's funny, right? I used to call it the Shrek because they'd walk around. It's like this thing that you see, and you're like, oh my god.
Yeah.
It's like it takes 30 minutes to fix it. Just do it.
Just do it.
Yeah.
Just
don't charge them. It's fine.
yeah. It's fine. It's fine. Running a not-for-profit.
Yeah.
Yeah.
That's what Shayna
That's what I
says.
like to do.
Yeah.
It's our pro bono contribution to the
I
world.
have a handful of that. It's fine. It works for me.
It's
Pro
so
bono
hard.
injector.
All right, a couple questions to end it.
Oh, what?
Any questions?
I was gonna say, I wish my surgeon would have said, your brow can be free. I'm like, okay. I paid for it.
Did you get a brow lift?
She did, and it's
With
like,
Kirchen?
yeah.
Yes.
Did you do the endotine?
Yes.
Nice. It looks good.
Yeah.
Let me see. Take your glasses off.
I don't think I knew that, Amber.
Yeah, it looks freaking great.
Well, she kind of had naturally had higher brows.
Really?
Like she's like, I don't know. And then I was kind of telling her, I'm like, I do think it worked because you do have such a good temporal lift on that brow where
Yeah, your brows look
like you
awesome.
you're gonna probably not have tox issues. I don't think where
Yeah.
somebody wasn't treated. And like Katie Moyer, she Michael Lee did her brow lift and same kind of thing. Like it looks really. She was even kind of disappointed with it when she first did it, and it took about a year to settle in. And then she was like,
takes
"Now
a
I
year.
get it."
Yeah.
Yeah.
And then you look at the before and after pictures,
Yeah.
and you're like,
Oh,
"Ooh,
okay.
that looks really good."
Yeah.
I just saw. I did a brow lift on a lady a year ago. She came in to get her sutures out and then never came back.
Of course, that'd be like me.
Yeah.
She's like a vice principal or a principal somewhere,
Yeah.
and now school's out and she comes back, and I'm like, oh my God, your brows look insanely good.
Yeah.
It's
Wow.
like yours, really,
Yeah,
really,
really nice.
pretty arch.
Uh-huh.
And I look at her before pictures and it was like,
Oh, yeah.
Flat.
I'm like, oh my God, thank God,
Yeah.
this looks so good.
Yeah. Yeah.
I was like, I didn't know she didn't come back because she was unhappy or
Uh-huh.
what. And I'm like, this looks really
Left
good.
wondering.
Yes.
Yeah.
Yeah, and that's the worst is when they disappear into the ether. You're like,
I wonder what
am I the
happened.
problem?
What happened?
Yeah, is it me?
I don't
Is
know.
it me?
Yeah.
I have a Dr. Halani.
Okay.
If they took away your license, your medical license tomorrow, what would your second career be?
Oh, I would be a high school math teacher.
Really?
Oh.
I could
That's-
see that.
That's the yeah. That's
What grade and what kind of
okay. So I like being a doctor because it's like teaching and educating, and I've always loved math. My best teacher. I've had two really good teachers in my life. Both were in high school. One was my Spanish teacher, and I actually email her like every 2 or 3 years thanking her for
You
teaching
do?
me Spanish. Yeah,
Aw.
I still hear her in my head. Like
Aw.
to this day, she's retired. She's
Uh-huh.
like 80.
Yeah.
But I had an amazing math teacher, and I love math, specifically calculus. So I would be a 11th, 12th grade calculus teacher.
Interesting.
Interesting. Yeah.
Public school.
What about you?
Oh,
Oh.
yeah.
Public schools.
Public
For
school.
sure.
Took away Youthful Magnolia. What would,
Mm.
what would be
So I can't default back to the operating
You
room
can't
and
do
do
that, you can't.
anesthesia? Okay. I think I would like to be like a fitness coach, believe it or not,
Ooh.
because I think it would make me go work
Oh.
out more. Actually, I used to love working out, and then I created a business, and now I have no time.
You
But
just run around here.
I just run around
You should
here
run
and go upstairs.
Pilates studios.
Yeah.
You know
Ooh,
what?
You could
I
make a
wouldn't mind doing
wellness
that.
studio.
We should do a Pilates studio.
Ooh.
It would be nice. Oh yeah,
Yeah, I
Amber used to
forgot
teach
about
You're a
yoga.
yoga instructor?
Yeah, perfect.
Wow.
Perfect.
We should do
One of
that.
many talents.
Love that.
Yeah.
What about you, Grayson?
I mean, I started college as an art major.
Oh yeah.
Ooh.
So I'd probably do some type of like graphic design,
Social media,
yeah,
graphic
marketing.
design. She's actually really good at Canva. I'm like,
Really?
how
I
do you
love
know how to do
Canva.
that? I said, how do
Wow.
you know how to do this stuff? She's like, well, I took a class. And I was like, geez,
Yeah,
maybe I
learned
need
a
to
little
take
bit in
class.
college. My dad's also like someone who can do anything and super techie. He can figure anything out, whether it's like a brand new computer he's never seen, you put it in front of him, he knows how to use it.
Wow.
So I feel like that helps me too with social media and Canva even. I just play with it and learn it,
Figure
and then
it
it
out.
becomes fun.
See,
That's
Yeah.
awesome. That's really good.
Polar opposite on that.
Yeah.
Yeah. I didn't know that would come in handy as a nurse.
Yeah.
Doing
But it
injections.
does.
Yeah,
Yeah.
because somehow we have we've lost the line of like privacy when on the aesthetic side of things. Like from a surgical side at the hospital, it's a whole different ball game. Because I remember back, it's been a long time ago, and I was fairly new as a CRNA at JPS, and they did a AAA repair, which you hardly ever see that anymore because now
Yeah.
everything's done
Endoscopically, yeah.
endoscopically, and so
Endovascular.
endovascular. Yeah, I'm like,
Sorry.
wait, that's the other side.
Yeah, sorry.
No, it's me too. And they pulled out this huge amount of like this fat cholesterol, like blocking this whole entire thing. It was crazy.
Wow.
And so like some of us took a picture and they made such a big deal about it. And
Really?
oh my gosh, yes. I'm
Wow.
like, this is so educational. Why would we not want to share this to like the general population of
Yeah.
being like, this is why you want to like don't
This is what
smoke, don't do
happens.
these things.
Yeah.
Like this is what people are getting out of the body. But
Wow.
now it's
No
like
identifying factor.
no
of
identify.
the-
Yeah, there's no human in it.
Yeah,
it's
it's
just
like
fat.
non-HIPAA. It's
Yeah. But anyway, so yeah, there's such I don't know, it drives me crazy.
just-
Like I hate putting before and afters up there because
You do?
No.
I hate it. Yeah, he's like, "Can you send me something?" I'm like, "No."
No.
I like it's like
And she has the best before and after.
well, I like to like and a lot of people they're like my friends, or
Yeah.
It's hard.
other people providers I've worked with and then but what I really like are like 3 to 5 years out, those type of before and
yeah.
afters where you're like really getting to watch that aging process and like what these biostimulators and things like that can do and lasers and one of my pet peeves with Instagram and social media is like when other practices are kind of promoting like filler and things like that. It's like they'll post these really the before and afters and they're pretty dramatic.
Totally
But then
different
you look at
lighting.
the skin and it looks terrible.
Yeah.
Like, why didn't you address their skin?
Yeah.
Yes.
Like,
Yeah.
you could have such a pretty result. And I don't know, maybe they wouldn't have needed all that filler because you could have brought that, contour back to that
Yeah.
cheek or the shine and things like that. Like Moxie can, it can just polish up anything. It's
Yeah.
crazy.
Yeah.
But yeah, so it's like, ugh, I can't even look at them. I'm like, I can't go from that. And even for me, if I do like some before and afters and we haven't done lasers or like they're at that first part of that skin treatment,
Yeah.
like I can't even, I
You're like,
can't
I'm not doing it.
Can't do it until the skin gets pretty.
Yeah. Wow.
Yeah.
What's yours, Grayson? Your aesthetic pet peeve.
Pet peeve? Oh gosh. I don't know. I mean, I think it is hard on social media that people come in with preconceived notions and think that you can come in and sit down once and then leave looking like
Right.
maybe a 3-year photo could
Right.
be. And then it puts a lot of pressure on you to I feel like I'm an empathetic person, and so I feel that and want to do the best for them, and recommending a staged treatment can feel slimy maybe to a patient. Like I don't want to feel like they came in for maybe filler.
Right.
And they're leaving with a recommendation for 5 different things.
Right.
So it makes me feel bad, but just like we've been talking about, it's the best thing for them.
I know.
Yeah.
It's hard.
It is hard.
I don't like spot treating.
My biggest aesthetic pet peeve is non-standardized lighting for before
Oh my
and
gosh.
afters.
Yes.
He
So-
knows how much this drives me crazy. And I
So-
cannot
Yes.
find a place. I cannot find a wall here that gives me the consistent before and afters
You
I
need
want.
like a room.
I need
Yeah,
a room.
so in my office, before I joined the office, there was no standardized studio.
Uh-huh.
So I built
Okay.
and designed the photo room in
Yeah.
our office. I have a standard black background. I bought my own camera.
Uh-huh.
I manually set all of the settings. There's
Uh-huh.
like tape on the floor where the
Right.
camera
Yeah.
should be. The height is screwed into the thing
Uh-huh.
for body and face. And then I have a stool with a piece of tape on the black background where the head should be.
Yeah.
And so the hard part in photos is the 3/4 view for faces.
Yes.
Right.
And so I numbered the wall
Uh-huh.
with stickers so that every 3/4 view and every view is exactly the same.
Okay.
Every height is the same, focal distance the same. Because non-standardized photos, that is peak
Mhm.
sliminess.
I know.
Yes.
Because you're
Yes.
misrepresenting what's possible.
Right.
And I also hate iPhone photos.
I know.
Yeah.
Before and afters on iPhones.
know.
Yeah.
Is that what you do?
Unfortunately, I have
Okay,
an
sorry.
iPad.
Yeah.
Hard over here.
Sorry.
Listen,
sorry.
I've been
Fishbowl
telling
your
Fernando.
Yes.
Please.
You've got to get back and
Yeah, you have
zoom.
to be. Yes.
You do.
You have to be
Versus
far.
it-
You do.
Yeah. My plastic surgeon taught me that.
Yes.
Because I'm sure you delegate all your pictures.
No,
No,
I take all my own
someone-
photos.
No.
Most of the
Really?
plastic surgeons try to take their own. They're
Yeah.
very peculiar, especially
He was-
UT
yeah.
Southwestern trained physicians.
Yeah.
They must
Wow.
crucify you guys
Yes.
in your
Yeah.
residency about it.
It's they literally put a thumbtack through your finger to the
Yeah.
wall. But yeah, I take all my own photos
Okay.
for faces. For
Yeah.
body, my nurse Linda has been taking photos for like 30 years.
Okay.
Oh, you trust her now.
I trust Linda.
Yeah.
I trust Linda with my life.
Okay.
But I let Linda take body pictures.
Uh-huh.
Okay.
But I take all my own photos.
Yeah.
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 And then we use RX photo for ours.
Oh, you do?
Yes. I don't have patient now, which would be the EMR
That's
that would
what we
match
use.
it. Yeah. We use aesthetic records and then I pay extra for RX photo, but
Okay.
it does like kind of helps you line it up as good as you can with the
Yeah.
iPad or this. But I went and trained with a physician in Amsterdam.
Oh, cool.
Yeah, he's really good with radius. Like he's kind of, I call
Really?
him the godfather of radius.
Really?
And his cannula technique is unbelievable. He's
wow.
really a wizard. But his photo room was like right under a staircase, and it is set up just like you just said. It is like
Yeah.
on a thing you saw. I think I showed Fernando, and I was like, we need this somewhere. I just don't know where.
Yeah.
Yeah, for me as like a new plastic surgeon in practice, only in practice for a couple of years, like photos are my currency.
Yes.
You know, and so like I want to be proud of them, and so that's why I take them all myself
Yeah.
because it's like this is all I have to show people
Uh-huh.
what I can do.
Yeah,
So I'm really extremely protective
yeah.
of all of that stuff
Uh-huh.
and my
Yeah.
brand, but really about my
Yeah.
photos.
Well,
Yeah.
I just saw a picture on Instagram this week
Yeah.
of someone posted and put together. It was so good of a before that had shadowed lighting, terrible lighting of before.
Yeah.
After was something like this.
Yeah.
Bright lights, perfect after.
You
Yeah,
posted
I
this.
reshared
I loved
it.
it.
Yeah.
I
They
loved
had
that.
nothing
Yeah.
done.
I thought that was amazing.
Yeah.
Yeah. I was like, oh my God, this is so good. I
Yeah.
hearted it.
You did
'Cause it was
heart.
so
Yeah.
good.
I saw that.
I loved that. It made me
You
think of
posted
this.
that?
She posted.
No,
well,
I
she
reposted
She
it.
reposted. We like
Okay.
to repost and repost.
Yeah.
a
I
lot,
like
you
that.
know?
That's
But I
good.
shared it on my
like that.
We're trying to
stories.
share the information as much as
love
we
it.
can.
Because
So
you can get bamboozled.
you can get bamboozled.
Yes.
And I think
It's
that
just
you know
like-
what's
Like
so
catfishing.
funny. Hold on, I gotta pull it up so you can y'all can look at this because she's so sweet, but it's just like she fell for. She's asking me a question about something that is so impractical, and it's like a skin tech spa, and it says DFW women notice your neck skin looking looser lately. That loose skin, and it's basically the Botox neck lift, and this is their fake before and after they posted.
Are you kidding
I'm
me?
not kidding you. She texted me and she said, "Do you think I'm a candidate for this?"
That's
I
a
can't
face.
believe-
That's two different
I was
people,
like,
ma'am.
First and foremost, that's two different people. And she was, would this work on me for my turkey leg? I'm like, no.
Like, yes,
should be illegal.
I was
definitely.
like,
I
no.
love that they trust you so much.
I know. Absolutely not. Do
A
not
Facebook
do that.
ad.
I was like, that is like totally not the same patient. And I was actually, she's somebody I'm hoping she will finally make an appointment, hopefully with you in the future, because she is
Yeah.
definitely needs the full meal deal.
All right, Dr. Halani, one more question.
Uh-oh.
Or
Tell
two
me.
more questions.
Tell me.
What's something your friends assume you can do just because you're a plastic surgeon that makes you laugh?
Ooh. Not a lot.
I have a friend that's like his wife is a eye surgeon.
Yeah.
So every time they're cutting the cake for their kids, like he's a plastic surgeon. You know?
Like, oh, you cut the
Yeah,
cake.
yeah. Like, we'll let his wife cut the kid. She's not.
I'm trying to think.
Oh my god.
People. Okay.
That's funny.
People always will be like, ask me any medical question at all.
Uh-huh.
Like, oh, like my knee's been hurting. I'm like,
Yeah.
I'm not that kind of
That's
doctor.
not my area.
One time I was on a flight. Oh my
Oh
god.
god.
And they're like, is there anybody that can help? And I'm like waiting. I'm like,
Please, somebody stand up.
it was an international flight. I was flying to, where was I flying? I was flying to Paris.
Uh-huh.
And I'm like, oh my God, please don't, like, let somebody else be available.
Yeah.
They're like, okay, we need somebody. I'm like, looking around, I'm
Fine.
like, not yet. Third time. Please, any medical professional. I'm like, okay. I get up. It's like, this girl had like a cramp in her calf.
Oh my gosh.
Oh.
She's like 24.
Oh no.
I'm like, she's like young, pretty
Yeah.
girl. I'm like, are you okay? Like, were you sleeping or like, were you sleeping weird? She's like, yeah, but like, I really don't want to die. I'm like, listen, I'm not that kind of doctor. I don't think I could help you if that happens.
Yeah.
And I was like, okay, did you try stretching out your calf? Like, obviously I'm worried about a DVT.
Yeah, yeah.
Mhm.
Check her pulse ox.
Yeah.
It's like 100, but her heart rate was like 50. She's like a fit girl.
Oh yeah.
She's totally fine.
Yeah.
I'm like, did you try stretching? She's like, oh, yeah. And it's like she had a Charlie horse in her calf. I'm like, ma'am.
Where
this
the
is
flight
a
attendants
Wendy's.
like, do we need to turn the plane around? Do we need to land the plane?
They ask you.
I know,
No,
yeah.
there's like a okay, so they'll ask you, like, is there anything urgent? No.
Yeah.
Okay. And then they have an app, like an AI app.
Yes.
That's like, okay, you answer all these questions, and their concern is obviously DVT-PE.
Yeah.
They're like, what's the O2 sat? It's like 100. All this stuff. And I'm like, she's totally fine.
Yeah.
Do
Yeah.
not turn this plane
Yeah.
around.
Do not.
Do not
Yeah.
land.
Actually, but the Moxie I could do on
Yeah,
you.
yeah. If she
I can
needs
fix
like an
this.
implant exchange, I'm ready.
I'm ready
Yeah.
for that. Have you heard of Motiva? I mean,
Yeah, do you like it? Have you heard of internal bra / Galflex? No, but yeah, I think it's that. They just assume that you were like,
the
know,
wizard of it all?
Diagnose
Yeah.
the
Yeah.
random ailments.
Right.
I was at the gym with scrubs on there. Goes, oh, did you save any lives today? I'm like, no,
No.
Yeah.
I did not.
No. But I improve people's confidence.
Yes, does that count?
It kind of counts.
Ish.
It makes you feel good.
Look good, feel good.
Yeah.
Yes,
Look good, feel
look
good.
good, feel
You know,
good.
Deion Sanders, didn't he patent that?
He did.
Yeah. If
No
you look,
way.
wait, what is it? If you look good, you feel good. If you feel good, you play good.
Ooh, you're gonna
Yeah.
love the way you look. I guarantee it. You
Yeah.
know what that is?
No.
What?
Men's Warehouse.
Oh my gosh. That's so good.
It's horrible.
That's good. Kind of cheesy, but good.
All right, this is for all three of you guys. What's a question patients ask that instantly tells you they've been spending too much on TikTok?
Well, that example
Yeah.
I just did
Like,
earlier.
you don't even say anything.
I mean,
That's the perfect one.
Yeah.
yeah,
Truly.
showing you, thinking a Nefertiti neck lift is going to give you a surgical correction, which is not going to happen. Yeah, definitely on TikTok too much. What else would be a
I
good
think
one?
neck treatments like Nefertiti, they see.
Yeah. Oh,
That's the most common
when
one.
they come here
Yeah.
and inject Botox against the mandible here to help release the platysmal muscle because that's so like prominent there. It ties in
course.
real thick there.
Oh my gosh, yes.
Yes. Or like masseter talks too.
Yeah.
I want to slim my
Slim
face. I'm like, well,
face.
bite down. Like you don't. Your masseters
Can't
aren't
feel
even
it.
engaged. Like, why do you want me to put tox in that?
Yeah, I think that same with me. It's like, are you sure you can't just do Botox or something?
Yes. Or Botox right here. to
Yeah.
fix.
Oh my God, yeah. Can you just put
Fix these
Botox
lines
here?
with
Can
Botox.
well, Botox fix these lines right here. I'm like, no.
I wish.
I wish it did.
I do.
We wish we could just sprinkle it all over the face. It doesn't
Put
work
it in
that
the
way.
water.
Like, you guys are all like describing me too.
Just like,
girl.
That's good.
I love it. All right. Well, this wraps up our first of many series, I feel like, with Dr. Halani. And please reach out and ask questions and send us some requests so we can talk about it here because he's obviously very open to talking about it, which is so great. Thank you to both for being here. And I can't wait for our 12 series session to come out because it's coming. We got a lot to talk about.
Absolutely. Thanks for having me. Cheers.
Cheers. Cheers.
Miles of Cabo.
Yeah.